Goeienaand luisteraars en baie welkom hier by Eden FM en ons het Koppe Bymekaar. Dis Ronell Lemmer en ek het vanaand 'n baie spesiale gas wat saam met my gaan gesels en ek verwelkom graag vir Garth Newman. Garth, very welcome and I'm so happy that you're taking the time out of your very busy practice to have this chat with me tonight. Thank you so much for being here.
It's an absolute pleasure. Thank you for inviting me, and it's lovely to see you again.
Yes, it's always lovely to see you. Garth, we're busy in Cape Town, eh? We're really busy at this time. I'm sure you are as well. Your practice is busy.
Practice is busy, which is a sign of how things are going out there, unfortunately. But yeah, we've been very busy.
Garth, please tell our listeners about yourself just a little bit about yourself. I know you've got a wonderful new member in your family, and also just your interest in psychology and what your interests are.
Okay. Yes, I'm a clinical psychologist. I have a practice in Brackenfell and also a practice in Kenilworth, where I live. My special interest is adolescents. I work a lot with teenagers and younger children, but I do specifically focus on teenagers, particularly teenagers with anxiety and mood disorders. I think that's generally my area of interest. I'm in private practice now for almost a decade, and before that, for almost a decade, I was in the state service working at a psychiatric hospital in the child and family unit. So I have quite a lot of experience in working with kids and families in general. And I think that's where my interest in working with, or kind of specializing in adolescents came in.
Well, and as you're saying families, I'm thinking we can't exclude the families when we're working with children and adolescents, right? It's always often a family problem, do you think? Yeah.
Absolutely, it's almost always a family problem. I would say I see it as a system, and I actually use a lot of systems theory in my work. So I never see the patient as an individual that is not part of a system. There's always a unit. There's always a system which influences the individual quite dramatically, actually. So it's definitely, family work is definitely a big part of what I do.
Yes, I think so, Garth. And what I was thinking is, what I've been seeing with this time that we're living in is that there is a lot of anxiety and depression in children. But what I also notice is that sometimes this comes out in self-harm, and it's almost as if kids and adolescents are cutting themselves, they're harming themselves, and I'm wondering, it's always been quite a taboo subject, and if we could maybe speak tonight a little bit about that and your understanding about it.
Yes, absolutely. Definitely, it's an important topic. I agree with you. It is a fairly taboo topic, but it's a very important one for us to talk about, because in reality, the incidence of this, or the prevalence of self-harming behavior, is on the increase quite dramatically, actually. So it's an important topic, and I think one that we need to talk about more. So definitely that's something, and I see it in my practice. It's something that's increasing in frequency quite a lot. I get quite a lot of referrals from very anxious, stressed out parents who are observing, self-harming behavior, cutting, burning, and so on, any other form of self-harm. And obviously it creates a heck of a lot of stress for parents. So I get a lot of very frantic emails and phone calls from parents asking, what do we do about this very disturbing behavior? So definitely it is something that's on the increase and something that needs to be talked about.
So luisteraars, vanaand gesels ons met Garth Newman en ons gaan spesifiek fokus op selfbeseringsgedrag en ook met ouers gesels oor hoe miskien met hulle eie angs te hanteer en ook om met hulle kinders te werk. Garth, you said it's on the increase. Why do you think it is? What is it, like a fashion? Do kids, dare each other? What is happening?
I think there's a number of reasons why it's on the increase. The main reason, in my opinion, is that levels of psychological distress for children are on the increase. So that's one of the factors. I think that children and teenagers, the age of onset for self-harming behavior is generally between about 14 years up to about early 20s. And if you look at that population, that part of the population, there's a lot of stresses, there's a lot of pressures, way more than what there used to be even a decade ago. When you think about things like social media, etc., and there's just a multitude of different kinds of stresses that young people, have to endure. So I think that's one of the big reasons, is that the levels of stress, the levels of pressure, psychological distress, they are on the increase. And then you mentioned it potentially being a fashion. I think that is definitely also part of it. I hear a lot of kids talking about, they've seen their friend do it and they thought they'd just give it a try to see what it's about. You see a lot of this kind of stuff on TV. It's almost become popularized on certain TV shows. It's become glamorized on some shows as well. This idea of self-harming behavior being some kind of almost like a hack, to get yourself to feel better, or something along those lines. So there's a lot of the mainstream media is actually increasing the incidence of this quite a lot, I think. And then there's also this thing about fitting in. Teenagers want to fit in. And they can actually, some teenagers actually identify as a cutter, for example.
Yes.
And you can just see that they are seeking for a place to belong, and this is one of those places. And so they will identify with this behavior, and obviously then engage in the behavior because it gives them a sense of belonging. So I think those are the main reasons. Yeah,
what you're saying is so interesting. I never thought of that, that it's also a form of, or a part of belonging to a certain culture or a certain group. Someone once said that teenagers need friends or a group like we need oxygen. And it's so important for them. And that created another question. Do you think this whole COVID and the lockdown and everything could maybe add to this because they so much more on social media and their cell phones, trying to fit in that way?
I think so. I mean, I don't have any actual evidence of this, but just anecdotally, I have seen a huge increase in the number of patients that I'm seeing since the pandemic started with non-suicidal self-injury. And I think it probably is a combination of various factors, one being more consumption of social media. I speak to teenagers sometimes, and they tell me about the chats that they have. They tell me about these different groups, WhatsApp groups, etc., and even Instagram pages, Facebook pages dedicated to self-harm. And they latch onto these, or log into these groups, and they feel like they belong somehow. And almost can become a little bit, can become a bit preoccupied with it. So I do think that with the pandemic, to answer your question, it has increased the amount of time that kids are consuming social media or on social media. And so I do think that has an impact on the prevalence of self-harming behavior as well.
Yeah, you mentioned a word that stood out to me now. You said, and I can't remember exactly what it was. It was non-suicidal. What did you call it? Non-suicidal?
Self-injury. Non-suicidal self-injury.
Yeah. What do you mean by that? Because, often people think that these kids are trying to commit suicide.
Yeah,
non-suicidal.
Yes. That is one of the problems actually with this behavior, is that it sometimes gets confused with suicidal behavior, and it's actually very different. It can form part of suicidal behavior, cutting, any form of self-harm where you are damaging your body in some way. can be regarded as a self-harming behavior, but it's not always a suicidal behavior, because with non-suicidal self-injury, there is no intent to die. There's no intent to actually end your life. The issue, though, is often, and the literature does support this, is that non-suicidal self-injury often progresses to suicidal behavior. It often progresses into the person later on becoming suicidal if it's not treated early enough. So there's almost like this progression that can happen from just self-harming behavior, and then it progresses later on into suicidal attempts and ultimately even successful suicide. So there is that progression that tends to happen. But non-suicidal self-injury on its own is actually a separate cluster of symptoms, really, which has nothing to do with suicidality. It has more to do with affect regulation or emotional regulation, and less to do with a depressed mood or a desire to die, for example.
Sure. Garth, you're saying a mouthful, and it's really interesting. I'm wondering, you said that it can build up. Is it because children maybe start cutting and it's not that serious, or and they get more guts, and they not thinking about the consequences of the cutting, or and they become more daring in a sense? Is that what happens?
That's part of it. Yes, that's definitely part of it. Yeah, and the research also says that there's a sensitization effect that happens. In other words, children almost build up tolerance, and not only children, adults also, but it's usually teenagers. They almost build up a tolerance to the self-harm, to the cutting, for example. So they start to feel less pain when they are engaging in these behaviors, and so they need to actually, similar to using substances, you need to take more of the substance in order to get any effect. So there's a similar thing that happens with self-harming behavior, and that often progresses to further more dangerous forms of self-harm, and so ultimately that leads to suicidal behavior then as well. I don't think it's about being more daring. I think it's more about developing a tolerance to the behavior.
That word reminds me that we need to get back to that, Garth. I think we're going to go for an ad break. Luisteraars, ons gesels met Garth Newman, 'n sielkundige, baie ervare sielkundige in Kaapstad, wat met tieners en jong mense werk, en ek het ongelooflik baie respek vir sy opinie. So kom ons luister na een van die liedjies wat hy gekies het. Dis van Johnny Clegg, Scatterling South Africa, en dan gaan ons net nou verder gesels. So sien julle net nou weer. Luisteraars, welkom terug hier by ons het Koppe Bymekaar. Ek gesels vanaand met Garth Newman, baie ervare sielkundige in Kaapstad, en ons gesels oor selfbeseringsgedrag en selfharm, en hy het eintlik 'n baie interessante term gebruik, non-suicidal self-injury. So as julle ouers is wat bekommerd is, of selfs jong mense wat vanaand luister, wat sukkel met hierdie tipe van probleme, kom luister gerus saam met ons. Garth, you used the word tolerance. Is it in fact an addiction?
Well, that is a very big question. Some people do see it as an addiction. Some people see it as very similar to any other form of substance abuse, where it starts small and you gradually it becomes worse and worse. There is definitely an addiction model. There's various theories about why people self-harm, and the addiction model is one of them. There's a particular reward pathway in the brain that gets activated. The neural circuitry in the brain that is involved in pleasure and pain are actually kind of interlinked. So definitely it is seen by many people as an addiction. And I've seen people, or I've had patients who describe it as addictive, because what it actually does, what what non-suicidal self-injury actually does is help a person to regulate their emotion. So it can help someone who's in a state of real emotional distress, for example, to be able to very quickly calm themselves down. Or it can help a person who is really not feeling anything at all and feeling kind of numbed or dissociated or not present, to allow that person to feel something. To feel something is often a lot better than feeling nothing. And so
Sure.
just that alone will probably prompt that person to repeat that behavior again the next time, because it gives them something. There's some kind of reward for it. So it activates the reward pathway in the brain. And so there's this sensitization effect that happens. Now, next time I need to do it some more so that I can get the same effect. And then, it can increase in frequency and in severity in that sense. So yes, it definitely is, can be viewed as a form of addiction.
You're saying it helps people to calm down. Is it the action of the cutting? Is the blood flowing? Because that's a strange concept for many people. How can this calm you down? How does it work?
Well, it's a very complex kind of picture. There is a lot of research going into the neurobiology of it all. As I said earlier on, the neural circuitry in the brain that has to do with pleasure and pain are quite interlinked. But there's also other theories about the neurotransmitters, serotonin being one of the important ones. People are finding that, well, there's lots of research ongoing at the moment actually to try and identify exactly what's happening there. They have found that people with this behavior, with non-suicidal self-injury, have lower baseline levels of opioids, and so the cutting behavior actually increases their endogenous opioid production. So that actually, that's the substance that has to do with pleasure and pain.
Sure,
So
that's interesting.
Yeah. So they have found baseline levels of endogenous opioids in these patients is a lot lower. So there's a lot of theories as to why people engage in this type of behavior. There isn't one particular reason. If you speak to a person who is engaging in self-harm, often they say that it gives them a sense of relief, or it helps them to translate an emotional pain into a physical pain, and that the physical pain feels much more manageable than the emotional pain. So that is one common reason that people often give. Sometimes it's about punishment. Sometimes it's about self-punishment. A person might feel that they deserve to be punished. They deserve to be punished for some either real or imagined transgression, and they self-harm, and that gives them a sense of justice has been served, or something along those lines. So there's all kinds of different reasons, but ultimately it's about self-regulation. It's about emotional regulation. It's a very quick way of either bringing down distressed emotions, calming the person down, or helping that person to actually feel something rather than nothing.
Sure, Garth. So we as parents, it seems as if you're saying that we as parents need to understand that if my child is self-harming, he's in deep pain. There's pain involved. There's emotional pain involved that is causing this. So it's not a matter of they looking for attention or they being silly or something. What do we say to parents? How, because I can just imagine as a parent that you will get such a fright the first time you see this, and being very, very afraid yourself as a parent. What can you tell us about that?
Well, I think it would probably be any parent's worst nightmare, actually, if you think about it. And parents are obviously very, very distressed when they encounter this kind of behavior in their child. I would say the first thing for the parent to do is to try and understand, try and have compassion for what the child is going through. Because I think that it's quite easy to go into a mode of trying to control the behavior and to try and tell the child, just stop doing this, it makes no sense, you're harming yourself, and and to be punitive is probably the first instinct that parents have, and that's actually a protective instinct. But I would say the more important thing is to try and understand what the emotional sort of base is of that behavior. One of the useful models that I often explain to parents in terms of how they can potentially understand this is what's called the 4-factor model of self-harm. It's basically, if I can just speak about it quite broadly.
Please, yes, please.
Okay, so there's like 4 functions of a non-suicidal self-injury. It's basically automatic positive reinforcement or automatic negative reinforcement. And then there's social positive reinforcement and social negative reinforcement. So generally, self-harm can be placed into 1 or 2 of those categories. What it means, if it's automatic positive reinforcement, it's that the person is getting some kind of pleasure out of the self-harming behavior. And often it's the case, that they want to feel something, they want to feel alive. There's a feeling of excitement, a thrill, etc. And if that is the case, then obviously you would look at why that person is feeling so numbed, why that person is feeling so dissociated or not present in their own body. Why is there this lack of drive or motivation that's making them behave in that way, to seek that thrill? Then there's the automatic negative reinforcement, which is to basically stop negative feelings, to stop bad feelings, to stop overwhelming feelings. And that happens, I think, in my practice, I see that that's probably the most common one. So people might be feeling really, really overwhelmed emotionally, and this is a very quick way for them to just kind of numb everything and get rid of the difficult feelings. And then on the social side, there's the social positive and negative reinforcement. If a person is in the social positive reinforcement, it's because they gain something socially. Maybe they gain what we spoke about earlier, which is a sense of belonging, or they gain some other social benefit. That's the social positive reinforcement. And then social negative reinforcement is to somehow get away from a social task, to somehow get away from something like maybe being punished. So the person might behave in a way to to avoid something on, in social terms. So I think those 4 categories, if you think about it like that, and you try and place, why is my child behaving like this, and you try and place it into one of those categories, it will give you a good indication of what the treatment option needs to look like, or what do you actually need to address with that child. So it's a useful framework to have, just to ask those questions, and try and place where the child is. And it could be more than one. It could be in more than one category at a time, but it definitely does help to kind of understand that, so that you can then know where you need to target your intervention.
Sure, that's very interesting. So what do we practically say to parents? You said it might be one of the biggest fears parents have. So the moment that I walk into my child's room and I see this, or I become aware of this, my own shock and my own heart rate is going up, and my own, so I've got to fight my own emotions and now try to understand my child's emotions. That sounds difficult, so that's why I think we need more of these kind of talks.
Absolutely.
Get people more informed. So what is the first thing that a parent should do if it should happen, that you discover this for the first time?
I would say the first thing is to talk to the child, talk to the teenager, but emphasis on not being judgmental and not being punitive. So to try and get an understanding first and foremost about what's going on. But the one thing I would also caution parents not to do is to try and hide their own feelings about it, because I often find that even many therapists, I think, do this. Where you try and maintain this this kind of non-phased, objective state, almost clinical kind of position. And I think that for me, that's counterintuitive, because, you know, the parent should feel something about seeing their child actually, you know, harming themselves. So I think parents mustn't be too kind of rigid about it. I think they can express concern, and they can even express shock and surprise. And perhaps that's what the child actually wants them to express. At the same time, parents need to understand that the problem with that child at that particular time is emotional regulation, and the parent's job is to try and help that child regulate their emotion. And so that's the part where parents need to then remain calm, try and get an understanding of what's actually going on, and then decide with the child how you're going to deal with the situation.
Garth, I always have a problem with the question why. You know, to answer a why question is very difficult for people, even for grown-ups. And we tend to ask, why did you do it? Yeah. And that's a very difficult question, because then we just say, I don't know. So can you help us with a kind of example of what would be a good question to ask to try to understand what the child's feelings were or are? Can you give us a kind of practical example?
Well, I think you're absolutely right about saying the question why is problematic, because that can come across as judgmental. I think it's a fair question to ask. Every parent would want to know why, but I don't think the child is immediately going to be able to give them the answer. So maybe the question of why should be on hold until you have a better understanding of what's going on. I think to ask questions that are kind of open-ended to help the child also to make sense of it, because a lot of times the teenagers, him or herself, not really going to know exactly why they have engaged in behavior. So I would say, you know, using statements and questions that are kind of open-ended, but that demonstrate that you are genuinely curious as to what's happening, but also compassionate and empathic. So not just saying, why have you done this, but saying, let's try and figure it out together. Let's try and figure out what's actually going on together, so that we can find a solution for this, you know. But I think the minute you come with just a why question, it already is going to create some defensiveness, and you're probably not going to get the answer anyway. So it must be more of a collaborative kind of exploration of what's going on. You can express concern, definitely. You know, it's obviously very concerning behavior, and you want to understand it. So let's try and figure it out together, and let's try and work out a plan of how we're going to actually deal with it.
That's beautiful, because then it links into what you said earlier, that these problems are often family problems. It's often systemic problems. So if I say, let's figure it out together, I'm committing myself in this process of I'm also part of the problem. And maybe I am. And let's look at what's happening here and what I can bring to the table to bring some change. But as you spoke about the 4 factors, to me, as a parent of a teenager, I would think, it doesn't even matter what the factors are. I would immediately take to my child to a psychologist. I wouldn't want to handle this on my own. I would want to have support of a professional person. What do you think?
Yes, I agree. I think that it's essential that a child has professional help if they are engaging in non-suicidal self-injury. It's one of those things that I wouldn't suggest that parents try and deal with on their own, especially if it's persistent, obviously, because it does have that tendency to get worse over time. So I would say, I would encourage parents who encounter this to get an assessment done by a psychologist, even if it's only mild self-harm. The problem is that mild self-harm, it almost graduates to more severe self-harm, and then can end up being suicidal ideation, suicidal behavior. So I would say for peace of mind, even if it's very mild self-harming behavior, have an assessment by a professional person as soon as possible to avoid that, the sensitization effect where the person needs more and more and more self-harm in order to get the same effect.
Sjoe, luisteraars, tyd gaan so vinnig verby. Ek nou 'n vreeslike lekker interessante gesprek met Garth Newman oor selfbeseringsgedrag. Ons moet nou eers weer 'n kans gee vir 'n advertensiebreek en ons gaan nou na 'n ander een van Garth se liedjies luister, Cat Stevens, Wild World. Luisteraars, welkom terug by my gesprek met Garth Newman oor selfbeseringsgedrag. Garth, we were talking about how parents should try to stay natural and congruent to their own emotions and then try to understand what's happening with the child and trying to work together towards a solution. And I think parents might be they might want to control the situation by hiding all the cutting tools and the blades and taking everything away and searching the rooms for what's left there. What do you say to parents about that? Is it their responsibility to try and keep everything away?
I think it's a bit of a balancing act because it depends on the severity of the situation. If the child is at risk of causing serious bodily harm at that particular point in time, then the parent probably has no choice but to try and protect the child. But at the same time, it's often a lot more helpful, a lot more productive to allow that child to take some form of responsibility for their own behavior. And one doesn't want to always just come in and try and control the whole situation, but rather encourage the child to have more appropriate coping mechanisms. So I don't know if I'm answering your question, but I think
yes, absolutely.
Yeah.
Absolutely, I think you are. Thank you. And what treatment options are there for parents to who can they contact, who can they talk to?
Well, I think there are a number of different treatment options. I would say for parents who have children who are self-harming, it is important that they get a professional assessment done. It can be by a psychologist. I would recommend that it's a psychologist or a psychiatrist. Definitely an assessment, a proper assessment of the whole situation has to be done. So that would be the first step. There are a number of different possible treatment options that are available. And these are in the form of psychotherapy, which is the first line treatment for this type of behavior. Or then there's also psychiatric treatments, medication, and often the combination of those two gives the best outcome. But I think the first step is just to do that proper assessment to try and really understand what is going on, and then from there determine what's going to be the most appropriate intervention. And that the intervention should be determined based on severity, actually. In some cases, if it's already very severe, the child has progressed or the teenager has progressed to a stage where they are engaging in serious self-harm, then it might be best to admit that child into a clinic, into an institution for their own protection and give them intensive treatment. If it's very mild, then it can be probably treated as an outpatient, and then just some psychotherapeutic intervention can often be enough. So it just does depend on what the severity is.
Garth, and I'm going to ask you, could people maybe contact you on your email, or, with now we're doing Zoom sessions and it doesn't really matter what the boundaries of South Africa are. You can do Zoom meetings or Zoom sessions. Would you be willing to give your email address to the listeners?
Yes, absolutely. My email address is garth.newman@gmail.com. Quite easy to remember.
That's very easy. So I'm going to ask you to repeat it at the end again so that the listeners could get their luisteraars kry julle pen en papier gereed. Indien julle dalk vir Garth wil kontak, hy gaan weer sy e-mailadres vir ons gee later. Garth, let's get to the kids themselves. What do you want to say to the kids? They're really struggling. They really are having a lot of anxiety, a lot of problems that, you know, I really feel sorry for them. What do you say to these kids?
Well, I think you've actually kind of captured it in the way that you are posing this question, that you really feel sorry for them. And I think that's the first thing for me, is to try and demonstrate that you are there for them, that you care about them. And I think to have empathy. And I think this is what children, what teenagers actually need. So what I would say to the teenagers who are considering self-harm or who are self-harming is that firstly, you are not alone. There's help for you. I understand that what you are going through is extremely painful. It's extremely difficult and overwhelming. But I also know that you can overcome it. And I also know that working together with a psychologist or other mental health professional can really help you to gain the tools and the skills that you need to be able to respond to the world, to respond to your environment, or to respond to whatever problem you're having in a very, very positive way. So that would be my message to the teenagers. You're not alone. We understand it's very difficult, but we can get it. We can get you through it. That would be my message.
And if a teenager's friend is cutting, should they break the confidence? Should they break the secret and tell their parents, or what? How do teenagers help their friends?
Yeah, I think that's a very interesting one. Again, I think it depends on the severity of the situation. I would always encourage the person who is self-harming to get help for themselves, to take that first step. So maybe the first step for me, if my friend was engaging in self-harming behavior, I would try and encourage that friend and say, you know what, I'm concerned about you. I can see that you're struggling. So I would really love for you to get some help, and maybe even refer that person to someone and say, you can go and speak to this psychologist, or you can go and speak to the school counselor, or you can go and speak to your favorite teacher, whoever it is that you can trust. I would just encourage them to take that step of just, seeking help themselves. If the person is refusing to do so, and if the behavior is persistent, then it might be worthwhile just having a word with your parents, so that the parents can actually, intervene, or even having a word with one of the teachers at the school and saying, you know what, I'm worried about this person, because this behavior is persistent and it's ongoing, and it's increasing, and then in that way, you are actually helping your friend, even though your friend, you're breaking confidentiality, you're still doing it in the best interest of that person who you care about. So if the person is not taking steps for themselves, then in that case, I would actually encourage you to go and speak to an adult about it, so that you can get help for that person.
Garth, you spoke about self-regulation or emotional regulation. What does it mean? Explain to our listeners. What does it mean, and how do we do that?
It's your body's ability to remain in a state of homeostasis. So it's the body's ability to remain in a state of sort of comfort, if I can put it that way. It's the ability to be able to either up-regulate or down-regulate your experience in order to match what's going on around you. And our brains are very good at doing that. Our brains are good at responding very, very quickly to what's going on in our environment, so that we can, it's basically our survival strategy, where the brain needs to, survive, needs to tell the rest of the body what to do in all sorts of situations. When it comes to emotional regulation, it's the ability, I'll call it the brain's ability, to be able to remain in a state of homeostasis, to remain in a state of relative comfort and calm. People who have difficulties with emotional regulation might find that they very quickly fly off the handle, or very quickly lose their temper, or very quickly feel completely overwhelmed, and it often doesn't match what's happening in the environment. Or the person might find that they stay in an upset state for very long, much longer than what they should, and then struggle to come back to a state of calm again. So that's basically what emotional regulation is.
That's interesting, Garth. And so I'm sure there are some apps, calming apps, or I know there's an app called Calm Harm. I don't know what you think of that app. Do you know?
Yes.
Or
Yes,
other
yes.
apps that
Calm
you could
Harm,
maybe recommend?
yeah, definitely. Calm Harm is one. That is it's basically a very useful self-regulation tool that a lot of teenagers are using. I would recommend that. Very other useful apps are just the mindfulness meditation apps, because they actually help you to be present in the moment. So the two biggest ones are Calm and Headspace. Those are the two most popular meditation apps, and I actually often recommend these to teenagers, because I find that doing some form of meditation really does help to increase emotional regulation capacity. It helps the person to actually regulate their emotions better. So I would recommend those three: Calm Harm, then there's the Calm app, and then also Headspace.
Thank you. Luisteraars, ek kan nie glo ons tyd is alweer vanaand verby nie, maar ek dink ons gaan 'n opvolggesprek met Garth moet hê. Dit was baie lekker om met jou te gesels. Garth, I really appreciate your time and your willingness to share your knowledge with us.
Absolutely no problem at all.
Will you please repeat your email address again? En luisteraars, julle is meer as welkom. As julle meer vrae het, kontak vir Garth. Hy het 'n passie en 'n hart vir mense, en ek weet hy sal tyd maak om vir u te antwoord. So kontak hom gerus op sy e-mailadres, please, Garth.
Yes, it's garth.newman@gmail.com.
Thank you so much. Is there one last word that you maybe want to give to the listeners?
I want to say, when it comes to self-injury and non-suicidal self-injury, I want to say there is help out there, and it's just important to reach out. So to all the people who are struggling with this, you're not alone. There is help out there, and it's just a matter of reaching out, which can be quite a scary thing, but it's almost always a liberating thing when you do that. So I would just like to encourage people who are struggling with this to reach out.
Thank you so much, Garth. I really appreciate it. Luisteraars, ons gaan nou na die laaste liedjie van Garth luister, en dit klink vir my na 'n baie interessante een wat hy spesifiek gekies het. En dis deur Brendan Adams, Perfect Mood. Ons sien julle met 'n volgende maandag. Totsiens.